Hi, my name is Angel, the queer millennial, and this is Buddha. He may or may not leave in this video, but for now, okay, bye. So today we're going to talk about what to do for vestibular migraines. In the previous video, I kind of talked about my story with vestibular migraines, and so today we'll be talking about what to do for your vestibular migraines, what kind of doctor to see, how to prevent migraines, how to treat migraines, and how psychotherapy and physical therapy can help with vestibular migraines. I'm not a doctor, well, not that kind, and so all the following information is just for your information. It's what I've received from my doctors and also my personal experience, so take it for what you will. So, number one, what doctor to see? So typically you'll start with your primary care physician. Usually that is the first step. Usually when you have your annual physical preventative visit, you can tell them about your issues, and usually they're pretty good about being able to tell you what to do. They're usually pretty good and knowledgeable about stuff. At the same time, they can also refer you to a specialist. So, like if you're having a migraine, that's like neurology, right? So they can refer you to a neurologist. So I saw my primary care physician, and I have my notes over here. So if I'm looking over there, it's because I have my notes, and this is the stuff, the information that she gave me. Okay. So basically, for migraines, you want to maintain therapeutic lifestyle measures, including good sleep hygiene, routine meal schedules, regular exercise, and identifying and avoiding migraine triggers. And then she goes on to list like a list of migraine triggers. So food triggers: alcohol, chocolate, aged cheese, MSG, aspartame, caffeine, nuts, nitrates, and nitrites. Second category, hormones: menses, ovulation, hormone replacement, progesterone. The next category is sensory stimuli, so strong light, flickering lights, odors, sounds, and noise. Next category is stress, so letdown periods, so periods after intense stress. It's a typical or a very common thing that happens to people who have migraines. They usually have their migraines right after like a stressful period. Times of intense activity, like if you work out too hard. Loss or change, for example, death, separation, divorce, job change, moving, or crisis. And then the last trigger category is changes of environment or habits. So in this one, she said weather, travel, crossing time zones, seasons, altitude, schedule changes, sleeping patterns, dieting, skipping meals, irregular physical activity. So those are the things that my primary care physician was able to help me with. So the next doctor I saw was the neurologist. So the doctor makes a referral to the neurologist. The office of the neurologist will call you and make an appointment. Sometimes there is a long wait, so if you're on the fence about seeing a specialist, you should just make the appointment, because it's probably going to take a while anyway, and you can decide later if you want to go ahead and see the neurologist. So a couple months went by, and then finally I went to the neurology appointment. They asked me a couple questions about my symptoms and like what my triggers were, and kind of formulated this diagnosis. And so at this appointment, these are the notes that they kind of explained to me about what a migraine was. So this is a little bit more information than what my primary doctor had given me. So I will read to you what they gave me, the information that they gave me. So I explained to the patient that migraine is an inherited disorder of the brain in which the brain is hypersensitive to the changes in the environment as well as changes that occur within the body. Changes in sleep, stress level, activity level, hormones, any traumas or other medical conditions that the body is experiencing can be common triggers. And triggers are usually partial and additive. The foundation of migraine management is lifestyle modifications. We discuss specific strategies to create a regular and predictable schedule, an environment that can be helpful for migraine. It is imperative that the patient keep a regular sleep schedule and meal schedule. Studies show that 20 minutes of daily aerobic exercise can decrease migraine frequency and severity. The term migraine refers to a collection of symptoms that can include head pain, moderate to severe, light or sound sensitivity, nausea, vomiting, cognitive slowing. About 20 to 30% with migraine have visual, such as seeing lights, shapes, colors, and other positive visual phenomenon, sensory or motor aura. When a person experiences a migraine, he or she can be experiencing any combination of the above symptoms. So, do you see a pattern here about what the triggers are for migraine, and also in this little information blurb, some of the symptoms that come with migraine? So regular sleep schedule and regular meal schedule seem to be repeated here, as well as stress level, activity levels, hormones, blah 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 blah. And then she goes further to tell me what to come up with a treatment plan. So for prevention is to have lifestyle modifications with a focus on sleep, hydration, exercise, eating frequent and healthy meals, and stress management. And then other lifestyle modifications that she had suggested is to mark on the calendars the day that I have a migraine, the severity of it, and the rescue medication plan, which I will talk about now. So for vertigo, promethazine, oral and suppositories, and Zofran when necessary, as needed. Because I basically told her that my primary symptom that is bothersome to me is nausea and vomiting, and so all of these meds are just like for nausea and vomiting and not really for the migraine, because I don't know, I'm dumb. Anyway, so other lifestyle changes basically that they suggested will help decrease the frequency and severity of my migraines is diet. Eat at regular times each day. Eat protein throughout the day. It is especially important to start the day with protein, she said. For sleep, it's like a long-ass paragraph. Keep regular hours for going to bed at night and getting up in the morning. Do not vary the hours on the weekend. Do not watch TV and read in bed. If you are unable to sleep, get up and read something boring until you feel sleepy. Then go back to bed. If you are not able to sleep within 20 minutes, get up again. Even if you do not sleep well, get out of bed at the same time every day. Do not take naps. This will help you regulate your sleep and improve your sleep quality. See? Big paragraph on sleep. Alright, next. The goal is to exercise at the same time every day for at least 20 minutes at an intensity that increases your heart rate. So in the next video, I will talk about what I learned in physical therapy, and they actually suggest the same thing, to exercise at a moderate intensity for 20 to 30 minutes a day. I originally went to physical therapy because I had a concussion, and part of like improving your brain health and like healing your brain is to do cardiovascular exercise, and I think the reason is to have your blood flowing to your brain and kind of like circulating all of that stuff. And so really the baseline of health in general is your diet, sleep, and exercise. That's all I gotta say about that. So in terms of prevention or prophylaxis medications, they suggested magnesium 400 to 800 milligrams, as well as vitamin B2, which is riboflavin, 400 400 milligrams a day. These things take a while to kick in, so they recommended at least 2 months consistently to see if it helps. They also recommended some other prophylaxis medications. I will link you to the blog post I wrote about all the prescribed medications that can be used to prevent migraine. What I really liked about, this neurology referral was that, they specialize in this, and what I really appreciated was that the attending empathized with me, and she basically said that, I know, like, migraines can be really debilitating and really, I don't know how to say it. Just, so much suffering, right? And so I think that was the first time that anybody had actually acknowledged that. It made me feel like I was seen, that my experience was seen, and it's not just, a headache, right? And so even through all the doctors that I've seen, this was the first one that was okay, thank you. That's all I really wanted in life. Okay, anyway. She also had told me that they have other options, including, therapy, psychotherapy, because there has been a great association, I guess, between having vestibular migraines and having, anxiety, depression, blah, 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 blah. And so she also told me that they have specific therapists for migraines that I did not take advantage of, and I wish that I did. But I've been doing okay so far. So I will keep that in the back of my mind for when things maybe get bad again. And so because of my vestibular, my dizziness symptom, the neurologist referred me to ENT or otologist, an ear, nose, and throat doctor. And so I got on the waiting list for that. And let's talk about that next. So I had a vestibular evaluation, which included an audiogram, a video head impulse test, and a vestibular evoked myogenic potential test before I saw the actual neuro-otologist. So at the appointment, this was during COVID, so we had an online sort of thing. This part of the appointment gave me the most amount of information about everything about vestibular migraine, the term vestibular migraines. That was the first time I've ever heard of that. Before this, it was an atypical migraine or a migraine, or I would call them head deaths because I felt like I was literally dying and my head was causing me to die. So there's a lot of stuff here. I'm just gonna link you to my blog post where I wrote everything that she told me. But surprise, surprise, the same themes occur again in terms of, lifestyle modifications, sleep, stress reduction, exercise, eating well, staying hydrated, the just baseline aspects of your health. And so there's a lot of good information here that will take me freaking an hour to tell you. So I'm just gonna let you have the information in a written form, and you can go check it out on your own. Yeah, so just to give you an idea of what I'll talk about, what I wrote out in my blog post. So lifestyle modifications. There's some educational resources that you can read about to learn more about vestibular migraines. Physical therapy is a treatment option. Vitamins and supplements that I kind of talked about already, magnesium and vitamin B2, and there's other stuff like coenzyme Q. So this is what I was talking about, prescription preventative medications. So vitamin B2 and magnesium are over the counter. You can get them anywhere you get your vitamin supplements. I can link below the ones that I use. I get B2 from Amazon, and I get my magnesium from Costco. And then there's prescription rescue medications. So when you have a migraine, these are the medications that you take as an as-needed basis. So a triptan, which is a classic migraine medication, then you can take like ibuprofen, Tylenol. You can take for symptom management for nausea, Zofran. You can take promethazine, take prochlorperazine. You can take so many things. I actually will do a video of all the meds that I have. I should do that. I will do a video with my drug stash. And then non-medication options, which was interesting that I had never heard of. Travel motion sickness prevention, like over-the-counter, like Dramamine or Antivert. Yeah, and then psychotherapy and physical therapy. I found that physical therapy really helped me recover faster from my migraines in terms of the dizziness. So if you're interested in those exercises, the next video will be about the physical therapy exercises that really helped me with my symptom management and like feeling dizzy after my migraines. So make sure to subscribe, click the bell button so you don't miss out on that video. All right, thank you. Goodbye.